McDonald's pulling its popular quarter pounders off the menu at several Oklahoma restaurants amid a deadly E. coli outbreak. At least one person has died and 10 hospitalized across the U.S. Most of the people who are sick are in Colorado. That's where the fatality was, too. So far, there are no confirmed Oklahoma cases. However, the outbreak is raising new questions about our state's ability to test for certain foodborne illnesses. News 4's Spencer Humphrey is looking into it for us. What have you found out, Spencer?
Yeah, well, Kevin, a social media post from a prominent Oklahoma doctor got some attention this week after he pointed out that for several years, Oklahoma has been the only state that has to depend on labs in other states to process tests for foodborne illnesses. But tonight, Oklahoma's state health department says that's no longer the case. Oklahoma now on the list of states where McDonald's has temporarily stopped selling its quarter pounder after an E. coli outbreak linked to onions on the burger has sickened nearly 50 people across 10 states, one person even dying. The Oklahoma State Department of Health telling us so far nobody in Oklahoma has tested positive. But how exactly our state processes those tests gets a little confusing.
We are the only state in the United States that doesn't have the ability to do foodborne illness tracking testing.
Dr. George Monks is a past president of the Oklahoma State Medical Association. He says it's his understanding the state health department has not been able to test for foodborne illnesses since it privatized its public health lab and moved it to Stillwater 4 years ago, instead having to lean on labs in other states to help.
This new lab was built without a properly vented room for lab workers to safely perform this type of testing. We've been having to outsource that testing to Nebraska.
He says that really slows things down and isn't helpful during fast-growing outbreaks like this one.
We had another foodborne illness associated with red onion testing that went out of state, and apparently those results were lost. And so it delayed identifying people that could have been sick with that earlier outbreak.
But an OSDH spokesperson told me on Wednesday that's not the case anymore in a statement telling me Oklahoma's public health lab tests for foodborne illnesses, including E. coli. I followed up asking for clarification on if that means OSDH no longer sends those tests out of state at any point in the testing process and when that change happened. Late Tuesday, the spokesperson told me, yes, we test at the public health lab. I followed back up asking about this document on OSDH's website indicating OSDH does still outsource certain tests to that Nebraska lab and even some other places. The spokesperson says they'll look into it and get back to me during normal business hours. As for Monks, he says if the state truly isn't outsourcing foodborne illness tests anymore, that would be news to him and his medical colleagues.
So my understanding is we are the only state not able to perform this type of testing.
Now, of course, with some questions still lingering, we'll continue to work to nail down a definitive answer on this, and we'll share that with you and what the state health department says when they get back to us.
We'll look for your updates, Spencer. Thank you.